Hello, world, and welcome to the For Your Best Self podcast. It's Dr. Saluja, and today I'm proud and pleased to discuss one of my main areas of expertise as a cosmetic dermatologist, aesthetic skin injectables. This is going to be part one of two podcasts on skin injectables. These include neuromodulators such as Botox and Dysport and fillers such as Juvederm and Restylane, as well as the fat dissolving injectable Kybella and newer injectables on the horizon. I wanted to start with a question. Do you know the difference between Botox, Dysport, Xeomin, Jeuveau? These are called neuromodulators or neurotoxins. That's what the group is called. These neuromodulators relax muscles to help relax unwanted facial wrinkles. This includes lines between your brows, next to your eyes, even around your lip, chin dimpling, corners of mouth, lifting the corners of the mouth along the jawline and neck for subtle jawline and neck rejuvenation. And the goal is to look refreshed and less angry, less tired, less sad. I also do sprinkles of Botox or baby Botox, and that can be used for prevention of wrinkles or for a subtle, refreshed look. And patients may or may not have a preference of brand, but I wanted to review a few distinctions between the brands. So let me start with Botox. Botox, the onset of action is generally 2 to 3 days, and we see full results within 7 to 10 days. It lasts 3 to 4 months. Botox is considered the gold standard in treatment. It was first used for treatment in 1979 and then approved for cosmetic treatment in 2001. So it had the head start, and it's what we compare all the other neuromodulators to. Next is Dysport. Dysport's onset of action is similar, 72 hours, and people will see full results within 7 to 10 days, and the results last 3 to 4 months, but sometimes longer. There's a recent study of Dysport where you dose it a little bit higher, and the longevity was up to 5 months. Dysport tends to have more spread than Botox. It affects larger areas. I really like it to use it in male patients or in patients that have crow's lines that spread longer. Sometimes the crow's lines are a little bit broader or larger foreheads. Sometimes patients also feel like their Botox isn't strong enough or no longer working, so it's nice to have other brands, and Dysport is one of our go-tos. Dysport can also be used as a first choice as well. So another brand, Xeomin. Xeomin contains just one ingredient, and it's known as the naked injectable, and that can reduce the risk of reaction or rejection, and that's sort of Xeomin's play on the neuromodulator world. Its onset of action is similar, and again, 7 days to see results, lasting 3 to 4 months. Jeuveau is the latest neurotoxin in the market. It's purely an aesthetic neurotoxin. It's designed to attract millennials. They have a very stringent purified process called high pure technology. It is actually considered equivalent to Botox. Because of the purification and manufacturing, the onset of action is often 1 to 2 days. And again, full results in 7 days and lasts in the 3 to 4 months range. And Daxi, it's a new neurotoxin coming soon, Daxi. This is unique in that the purified protein is the same as the other neuromodulators, but it has a proprietary peptide, and that's a little amino acid chain that's added to the neuromodulator, and through some basic science mechanisms, it leads to a longer duration. So Daxi is going to arrive sometime in 2021 and be approved for a 6-month duration. So that's a little bit about the different brands of neuromodulators. I wanted to review, and if, let's say, before I go into instructions, let's say you're not sure which one you want. You don't have to worry about it. We'll help you choose. But some of our patients have questions on how we choose, so I wanted to give you a little bit of information. Let's discuss pre- and post-treatment instructions for Botox and the other neuromodulators. The beautiful part about Botox is that it's a no downtime procedure, and that's what everybody loves. There's little bumps that occur in the injection areas, and they're generally gone. The bumps are gone within 20 minutes. We do want you to avoid aspirin and related pain medications, as well as vitamin E and fish oil for 1 week prior to decrease bruising. You may want to take Tylenol or ibuprofen if you have a headache after. That's not uncommon. Even though Botox generally helps with tension headaches, you can get a headache, especially if you're new to it in the first few days after injection. We don't want you to massage or manipulate the injected site for 4 hours, and if possible, stay in an upright posture. Don't lie down. Avoid exercising or avoid getting overheated for at least 4 hours. When the effects wear off, then we just repeat treatment. We can adjust dosing. We can add areas at that time as well. Are there side effects? That comes up. There are no known permanent side effects. They're only temporary ones, and that's the beauty of the medical treatment, is that the side effects do tend to be temporary. They are very rare. Bruising's possible. That can be covered with makeup. It usually goes away in a week. Forehead line injections can cause some brow heaviness, so then doses are adjusted or that area is skipped. Sometimes other facial lines or normal facial veins will appear more prominent when treated, and then we discuss how are we going to alter treatment or refine the treatment. Other common side effects, you may, like we talked about, have a headache. Sometimes there can be asymmetry between sides, and then we adjust. Again, there can be a temporary eyebrow or eyelid droop. There is treatment for that. Sometimes an asymmetrical smile, again, very rare, but there's treatment for that. So the main, the main takeaway is really that the satisfaction is very high, 99% plus. However, it is I say all aesthetic treatments are part of a relationship. So you want to let your injector know so that we can refine and minimize side effects in future treatments. Will the facial expressions look unnatural? The goal is not to radically change your facial appearance. It's supposed to be a refreshment. And so we want to customize the treatment so they're optimal for you. And over time, we'll adjust the injections so that they match the results you're looking for. Some people really want more of a frozen look, and some people want decreased movement, but still some lines, just softening. And then what else helps? We always want to consider adding fillers and adding a home skincare regimen because they complement Botox treatments. Botox treatments work on the muscle, whereas fillers work in the fat and in the and over the bone. And then obviously skincare works on the superficial part of the skin. So antioxidants, sunscreen, retinoids are very helpful for reducing fine lines and improving elasticity. And so one of my favorite TNS Advanced Serum really can be used so that over time we have to do less Botox for wrinkles because the skin health is also improving. And then, we also sometimes will add laser treatments to help with the skin so that less Botox may be used over time. The beauty of it, however, is that you do decrease aging as the more regular you are with your neuromodulators. Next, I want to spend a little time on fillers. Facial volume loss begins in one's 30s, so this affects every adult. There are multiple types of hyaluronic acid or HA fillers, plus there's others. So let me do a brief overview of those. The main category that people recognize are Restylane and Juvederm. Restylane has Restylane Lift, Kiss, Refine, Define, and Silk, and Juvederm has Ultra, Ultra Plus, Volbella, and Velour. These are hyaluronic acid fillers. Hyaluronic acid is a substance found naturally in the connective tissues of the body. Kiss, Define, and Refine are considered flexible fillers. They're designed especially for areas with movement, such as around the mouth or the lips. Silk and Volbella have features suitable for very fine lines around the mouth. Velour is ideal for subtle improvement of the entire perioral or lower face area. Hyaluronic acid fillers can be used all over the face. They can be used in the folds. They can be used under the eyes. They can be used in the lips, horizontal forehead lines, jawline, chin, contouring. So really a widespread use. The results are immediate. They tend to last 6 to 12 months. Considerations and possible recovery up to 1 week, swelling, lumps and bumps, redness, tenderness, or bruising. With subsequent treatment, the results get longer lasting and the recovery period tends to be milder and shortened. And these fillers may actually stave off future lines and wrinkles by stimulating collagen. All hyaluronic acid fillers are reversible with medicines called Vitrace or Hylenex, and those are tiny injections that can be used to really refine the process if there are lumps or bumps or something that you want less of, and that happens within a few days if there's an undesired effect. Voluma is another Juvederm, and it's a uniquely prepared Vicross technology filler, and that technology in Voluma helps it last longer and also helps it to give projection in areas such as the cheek and chin and jawline. The results can last 9 to 18 months, closer to 2 years sometimes if 4 to 6 syringes are used in an area. And then sometimes, people say, how long do fillers last? Well, fillers will last longer if more are used. When we say a cheek may require 4 syringes and we do a full correction of 4 syringes. We tend to get the closer to 2 years out of it, but sometimes we say, let's be more conservative and let's do a half dose. So we use 2 syringes and then we might get closer to 1 year out of it. So there is a range. There's newer HA fillers on the market. One is called the RHA collection of fillers. These are made in Switzerland, and they got approved in 2020, RHA 2, 3, and 4. They're also hyaluronic acid fillers, and they're intentionally designed for facial dynamics, the movement of the face. I think a lot of people are, a lot of patients ask, I don't want my face to look unnatural or feel unnatural or feel stiff. And so the advancements in fillers are really designed to help the face move very naturally. Another filler called Versa is a hyaluronic acid filler, and that is especially known for its less swelling. Then we move into the non-HA fillers. Sculptra is one of my favorite fillers. It's not truly a filler. It's made out of polyl-lactic acid. Sculptra is a foundation filler that provides structural support. It's really collagen seeds that are injected in saline. We call them collagen stimulating seeds, and they're suspended in saline and injected into your face, and it helps stimulate your own collagen. It's appropriate for sunken parts of the face, hollow cheeks, temples, jaw, cheek, and it gives an overall revolumizing or recontouring of the face. It's very subtle. We consider it often in younger patients who may have early signs of skin or fat or bone aging and want to be proactive. The interesting part about Sculptra is the results are not immediate. Sculptra injections are usually done over multiple treatments, spaced 6 weeks apart, and the results are seen in 90 days. After full treatment, results can last 2 years. People will come back for a maintenance treatment 1 to 2 years from their series of treatments. And a series can be determined based on facial mapping. Often a 40-year-old will start with 4 vials of Sculptra over 2 to 4 visits and then come back in a year or 2 for maintenance. The Sculptra is the filler that's massaged, not the others. Usually there's facial massage for 5 minutes, 5 times a day for 5 days. And that helps stimulate the microcirculation so that your body can help, build this collagen scaffolding. Swelling, lumps, bumps, redness, tenderness, bruising is possible like it is with the other fillers. Bellafill is called our longevity filler. It is injected often in acne scars, nasolabial folds, smile lines, temples, lateral cheeks, not near the lips or eyes. Sculptra is not injected near the lips or eyes, either is Bellafill. Bellafill is really wonderful for patients who have filler fatigue. They're just tired of getting injected, and they like their filler results, so they know that they want these results, but they want it to last longer. So Bellafill lasts at least 5 years. In fact, once it's injected, the body does not dissolve it, but because the face changes over time, you would do a periodic maintenance, just not as often. So the results are long-lasting. Because the filler is non-reversible, we do a allergy test with Bellafill 4 weeks prior to treatment to make sure that there's no reaction in the skin before injecting the face. This is a complimentary test and also a nice time to consult on Bellafill. Radius is another filler. It is a synthetic form of material found in bone and teeth, and it's called calcium hydroxyapatite. It's not, again, used under the eyes or around the lips, but more in structural areas of the face, such as the cheeks and jawline, and the results are immediate. And Radius tends to last 4 to 12 months. It's good to have options. Sometimes one filler, for example, if a hyaluronic acid filler isn't lasting long for a patient, then we can switch to Radius or Sculptra or Bellafill. Now, Kybella is an injectable, but Kybella is not a filler. It's an injectable that recontours by breaking down fat. The medical term for Kybella is called deoxycholic acid. It's a naturally occurring molecule in the body, and it aids in the breakdown and absorption of fat. So when injected into the fat beneath your skin, it causes destruction of those fat cells. And once those fat cells are destroyed, those cells cannot store or accumulate fat. So it's not like Botox where it wears off every 3 months. Once Kybella has destroyed the fat is destroyed. The most common areas for Kybella are the chin profile and the jaw contour. Also for mild jowling, we will use Kybella. The results are not immediate. Kybella requires 2 to 4 treatments spaced 8 weeks apart. Most people require 2 to 4 treatments, but some people can require up to 6 treatments. The results are long-lasting or permanent. And then beautiful part about Kybella is where it's destroyed the fat, it creates a scar tissue that tends to give the skin lift. And so we're getting a lifting effect with the Kybella that's a really nice additional benefit. Renewava is another filler. It's considered an off-the-shelf fat. It comes from donated fat stem cells, and it can be injected in the office to the face, breast, body, and less commonly, it can be used as a filler in the face. When you're thinking Renewava, think small areas of the body. Examples include Renewava can fix liposuction contour irregularities, cellulite irregularities, implant rippling in thin patients. You can read more about Renewava on our website under fat grafting at www.foryourbestself.com. So I talked a lot about the various kinds of fillers, and you don't have to know what filler you want. That's our job to help you decide, and that's your injector's job to help you decide which filler would be best or which combination. Often we use a combination in patients at the same visit or within the same year or few years. In fact, one of my favorite things to do is something called liquid lifts, and liquid lifts are where we combine Botox, Dysport, the Neuromodulators with various fillers for a truly customized result. Some of the instructions on dermal fillers is you definitely want to tell us if you have a history of cold sores, because we want to pre-treat you with medications such as, say, cyclovir or famvir, so that we don't aggravate or instigate a cold sore. With injections, you want to come to your appointment with a makeup-free face, because fillers are an implant, and so we don't want to have particles of makeup get in with the implant. So we say no makeup, no skincare products for before your treatment. We're going to cleanse your face well. We're going to cleanse it with surgical soap and alcohol, so that we're prepping for a sterile procedure. We ask that after the treatment you avoid airline travel for a day, as well as exercise, extreme cold or heat, basically anything that could increase swelling or irritation we want to hold. The other instruction that's important to note is that dental procedures and vaccinations should be held for 2 weeks before and 2 weeks after treatment. We advise to avoid blood thinners for 1 week prior to injection, and to minimize supplements that can increase the thinning of the blood for at least also 1 week prior to injection. You want to minimize touching the areas and not massaging the areas unless it is Sculptra, in fact, that we're injecting. It's okay to gently wash before bedtime. Some of our patients will take arnica tablets, 3 tablets 3 times a day for 3 days before and after treatments to reduce bruising and swelling. It also improves the inflammation in the area. And some of our motivated patients will also add an antihistamine the evening after treatment. An antihistamine includes Claritin or Zyrtec or Benadryl. It's normal to have bruising and swelling in the first few days, so don't look in the mirror and assess your results really until 1 week post-treatment. Some people have mild swelling, some people the swelling is more significant, and the results do improve over the course of the week. We do advise prednisone tablets for people which is a steroid for people who tend to swell more. And in some cases of significant bruising, we have a laser that breaks down the bruise, and so the patient will return the next day. We'll use the laser over the bruise, and then the bruise will not last as long as it would normally. So that's a couple of nice pearls in terms of speeding up recovery. A lot of patients will ask, should I use ice? We ask to avoid ice because ice decreases blood flow to the area, and we want to actually have enhanced blood flow to the area to help with healing. So avoid ice. It's normal to see asymmetry or feel lumps or bumps for up to a few weeks after treatment. Over time, the skin will grow around the filler, and the feeling of the filler will feel very natural, and any lumps or bumps will soften. So we have our patients call obviously with any concerns, but give it time. We just implanted something into the skin, and although the implant is made of ingredients very natural to the skin, there's still some recovery for the body. There is one side effect that's significant, that is extremely rare, but is important for all of our filler patients to note. And that is if you're experiencing worsening pain or white discoloration, almost like a blanching or a dusky nature to the skin, the blood supply may be being cut off by the filler, and that's called vascular occlusion, and that's an emergency that does require treatment. So you do not want to wait. You want to call us or call your injector immediately if you were to note that. And hopefully we're just reassuring you, but at least we have the chance to evaluate it. So don't be shy. I think that's really important when you get injected, to not be shy in asking questions or in talking about what's going on with you. So I wanted to talk a little bit more about Sculptra, because Sculptra has a special place in my heart. Sculptra is, it's made out of polyallolactic acid, which is like sugar beads. And these beads stimulate the collagen, or I was calling them collagen stimulating seeds. And they're really good. It's really good for non-smokers, for less sun damaged skin. And it works great with skincare. Elastin Restorative is one of our favorite skincare products that it works well with, and with treatments that we do in the office that our estheticians do, like microneedling and PRP and PRF. And Sculptra's been around since 1999, and it's still considered very modern and secretive because of its because it gradually improves skin structure over time. And we begin losing 1% of our collagen per year starting at age 18, and it levels off, but it starts early. And I think that the earlier we start, we can slow down kind of the extent of collagen we lose. So when we think of Sculptra, we're not renting space with a filler. We're actually owning our own collagen. It's helping us keep what we already have, and so doing this sort of short-term series helps us really long-term. I treat myself with Sculptra. In fact, I do the most Sculptra in this area, and in Central Florida, and in a handful in Florida. And I really strongly believe in it. So I've actually also recently injected my 19-year-old son with Sculptra to kind of help with his jawline and slow down his collagen loss over time. So that's really strong evidence that I think that Sculptra is something that we all want to consider. And it's interesting, it globally helps the face, and you can layer it with other fillers. So just because you do one filler doesn't mean you can't do the other. Some people will ask me, what about side effects? One possible delayed side effect of Sculptra can be small bumps under the skin in the treated area, and these can occur within 6 to 12 months. They're not usually visible, and they most often self-resolve, but they can be treated if needed. And so let's say a 40-year-old wants to start Sculptra. We might come in and do 2 vials, and then 6 weeks later do 2 more vials. And then, a year later do 1 vial, but maybe in between we want to enhance lips or work under the eyes, and we can add a little Restylane or Juvederm as well in between. And so it's nice to have a Sculptra as a foundation. And I think that when you're combining injectables, that's where the magic is. So sometimes we stop at, what patients say or know, which is, I want some Botox and I want some Juvederm. Well, let's add a little Kybella to soften, the submental fat underneath the chin, to contour the chin, and let's add a little Sculptra to slow down the aging and soften the overall face. And then we have a little bit more of a customized treatment, and we're using injectables to the best of their unique properties. So it's really an art, which is why we recommend doing a full facial mapping consultation initially. I want to finish off with talking about the top Botox misconceptions and then the top filler objections, because these come up often, and it's nice to just be able to review. So the top Botox misconceptions, patients will say, well, I want to inject the horizontal forehead lines because I want to lift my forehead. And that's a misconception. Botox relaxes muscles, so over-treatment of the horizontal forehead lines actually weakens the frontalis, the lifting muscle of the forehead. And there is a risk of brow dropping. That's why I like to be conservative in treating the horizontal forehead lines, and I'll often try to leave some movement. So Botox, when it does the opposite, right? It opposes the muscle. So remember, your horizontal forehead lines are caused by the lifting muscle in the forehead. So if you want to reduce the horizontal forehead lines, you're going to reduce the lifting of the forehead, which may actually drop the brow. So it's not that we can't treat the horizontal forehead lines. We just have to be conservative and be a little more flexible in this area. Another Botox misconception is the Botox is over-diluted. Botox is always diluted. It comes in a powder and it's measured in units, and the dilution is not relevant. It's really the units that are relevant. You have to dilute Botox to inject it. And I think that's an important point to note. So, eyebrows. My eyebrows may look strange or funny, or my smile is crooked. If an eyebrow is unevenly raised or spocked, or a smile is asymmetrical, this is correctable. So Botox, we're siblings on each side. We're not twins. One side is genetically different than the other side. We're related, but different. So if a side is stronger, it may take the Botox slightly differently than the other side. So you wait 1 week after injection, and then you get a touch-up to refine the brows or smile. Touch-ups are in. That's how you get the best results, is by making your touch-up appointment. And then over time, you won't have to do the touch-ups because you'll know what to do on the first, or will know what to do on the first treatment. And then another misconception is Botox can only be used in the upper face. And that's true. It can only be used in the upper face for beginners. Actually, for me, one of the favorite areas I like to inject with Botox is the upper neck and the jawline, because it really does help lift the neck and define the jawline in terms of the muscular. We have platysmal bands that pull down on our jaw and on our neck, and by relaxing those bands, we will get a lift in the neck and the jawline. And it's really nice to use in conjunction with fillers. I also like to use Botox to help rejuvenate crepiness of the neck, the chin, dimpling, corners of the mouth, and around the lips. And then I'm going to finish up with top filler objections. Patients will say, I'm afraid I won't look like me. You will still look like you. It's just going to be restored. And if you desire, we can also enhance. So objectives of the filler can be to restore or to enhance. And the goal is always natural looking results. And that's why you want to check for experience and ongoing education in your injector. Newer fillers and newer techniques are more flexible in the skin, and they move more naturally with the skin, and so you will look like you. Another objection is, I'm not sure I want more than 1 or 2 syringes. I don't want a lot. 1 syringe of Restylane, 1 syringe of Juvederm is 1 milliliter, so that's 1/5 of a teaspoon. It's not a lot of product. If you think about it, 1/5 of a teaspoon is like nothing. It's strategically placed to highlight the structure of the skin. In fact, more syringes often give more natural results due to respecting facial balance and harmony. So sometimes I can make the face look more natural with 8 syringes than I can with 2 syringes. So don't worry about the quantity of syringes. Worry more about what your desired result is. Sometimes we can do multiple syringes at 1 visit, and sometimes we'll break it up over several visits depending on your personal preference. Another objection could be, I don't want to feel pain. And so we do use prescription strength potent topical numbing ointment. It's quite effective when left on for 30 to 60 minutes. We call it our magic cream. There's lidocaine in it, and it works very well. The fillers also have lidocaine within them. So pain is really less of an objection than you might think. We use ice rollers. Ice tends to cool the skin, right? Ice will cool the skin, and the coolness of the skin makes any procedure less painful. We talk and we tap and we dance as distraction. It's well known that when you tap the skin in another location, the mind is distracted, and so the attention will get split. It'll get diverted to the tapping, and then it's not quite as focused on the injections, and our assistants love tapping to distract. Pronox is a laughing gas we use, and Pronox actually increases comfort and decreases anxiety, and you can still be your own driver, so we love Pronox. Additional measures include dental blocks, especially for the lip area. I'm happy to do a dental block, and oral prescriptions are also available. Another objection, I'm worried about redness and swelling and bruising. I'm trying to hide this from so-and-so at home. Recovery is normal for up to 1 to 2 weeks. It's usually mild, and it's most significant in the first 1 or 2 days. Just dim the lights for a couple of days and you'll be all set. We recommend stopping supplements or medications that predispose you to bleeding 1 week prior. We recommend arnica starting 3 days prior to treatment. The ice rolling and kind of relaxation measures, like the tapping I was talking about, also decrease the risk of bruising. I do something called cannula, which is like a straw, using a straw to inject. The micro cannula is also an option to decrease bruising. And then we have topical concealers that can cover bruises. After treatment, the antihistamines, such as the Claritin, Zyrtec, and a couple of doses of oral steroids at low doses can additionally help with swelling if you have to be camera ready in a few days. Ideally, before an event, you really get your injectables 2 to 3 weeks before, so we have some time to refine and assess. But worst case scenario, we do have some things we can do to speed and recovery. Another objection: I don't want to keep coming back for treatment. I don't want to keep going to the gym, or I don't want to go to the dentist, or we all don't. There's so many things we don't want to do, but maintenance is the spice of life. And so repeat treatments usually are needed to maintain desired results. They're usually done once a year with fillers and every 3 to 6 months with Botox. The more you do something, the less recovery you have, and usually less product is required. And then, of course, there are the longer lasting options I mentioned that include Sculptra and Belafil. And then finally, I'm not sure it's worth the cost. And I think you really want to consider the value to you over time as the results build and last. There are loyalty programs that many of our injectable companies offer, and there are in-office packages that we offer that allow you to save on repeat treatments. And then, looking and feeling amazing can be priceless. That's really it's really truly priceless. So I want to make sure that that you feel empowered to get your injectables and know that you're worth it. And and that's a wrap on the For Your Best Self podcast, Skin Injectables Part 1. I'm Dr. Saluja, and it was a pleasure to be with you today. So subscribe to our For Your Best Self podcast on Apple Podcasts, Spotify, or Dr. Saluja, Dr. Novo on YouTube. And until next time.